There are images that are becoming the norm across America and the St. Louis region. Hospitalizations this evening are climbing and climbing as a new wave of coronavirus takes hold of our communities.
And as the data stacks up, Missouri's governor claims the increases, which are eating up emergency resources, has nothing to do with the coronavirus. Thanks for joining us. I'm Corey Stark.
And I'm Samantha Jones. The facts we're getting from the doctors with the St. Louis Pandemic Task Force backs up a more serious situation than what the governor portrays.
News 4's Russell Kinsall is at Barnes Jewish Hospital with this stark reality.
Yeah, right now, Barnes Jewish Hospital is not at capacity. That's the word from a spokesperson today. But the head of the St. Louis Pandemic Task Force, Dr. Alex Garza, said there is reason to be concerned in the near future St. Louis area hospitals may run out of space.
Are you concerned as the head of the pandemic task force about the capacity of local hospitals?
The short answer is yes.
Earlier in the week, on a visit to Pacific, Governor Mike Parson appeared to be downplaying the increase in hospital admissions in St. Louis and across the state.
The hospitals are actually getting busy because it's the normal business they do, not necessarily COVID-19 so much. We know the numbers are going up and we know people are going to the hospital.
It appears that Parson was partially right and partially wrong.
Setting aside COVID for a second, we are seeing increased demands on volume for healthcare.
Many patients put off elective surgeries till later in the year after meeting insurance deductibles. But statistics show the number of COVID patients in the region is also on the rise. There were 137 hospitalized COVID-19 patients on July 1st. It was up to 267 on August 27th. The number climbed to 296 on October 16th. And as of yesterday, there were 337 COVID-19 patients being treated in area hospitals. Here's what Dr. Garza learned a few days ago in a call with local hospital groups.
Some said they were above 90% capacity. Some said around 85%. If you talk to some of our facilities, they're full.
Garza said the situation hasn't reached the point where there's a need for an emergency overflow hospital like the one that was prepared earlier in the spring in St. Louis County. But he said if more people don't start adhering to the safety guidelines, there's trouble down the road.
I'm afraid we're going to continue on that climb, and at some point it will reach a crisis mode.
Another cause for concern for hospital capacity is right now there's a chronic nursing shortage. There are some doctors and nurses who can't go to work because they're at home in quarantine. And with the number of COVID-19 patients being admitted to hospitals on the rise, Dr. Garza called that a perfect storm. Live in Forest Park, Russell Kinsall, News 4.